HIV risk and prevention. What do you need to know? HIV, human immunodeficiency virus, is a virus that weakens the immune system, making individuals susceptible to infections and diseases. Here are some key points about HIV risk and prevention. Transmission. HIV can be transmitted through unprotected sexual intercourse, vaginal, anal, or oral, with an infected person, sharing needles or syringes, and from mother to child during childbirth or breastfeeding. High-risk behaviors. Engaging in unprotected sex. Having multiple sexual partners, sharing needles or drug paraphernalia, and having sexually transmitted infections, STIs, increase the risk of HIV transmission. Prevention methods. Safe sex practices. Use condoms consistently and correctly during sexual intercourse. HIV testing. Know your HIV status and encourage partners to get tested. Pre-exposure prophylaxis. PrEP medications taken by HIV-negative individuals at high risk to reduce the risk of HIV transmission. Post-exposure prophylaxis. PEP medications taken within 72 hours after potential exposure to HIV to prevent infection. Needle exchange programs. Use sterile needles and syringes to avoid sharing injection equipment. Treatment as prevention. People living with HIV who maintain an undetectable viral load through effective antiretroviral therapy, ART, have effectively no risk of transmitting HIV. HIV stigma. Addressing stigma and discrimination associated with HIV is crucial to encourage testing, treatment, and prevention efforts. HIV treatment. There is no cure for HIV, but with early diagnosis and access to ART, people living with HIV can lead long and healthy lives while reducing the risk of transmitting the virus. Testing and counseling. Regular HIV testing is important, especially for those at higher risk. Counseling and support services are available for individuals living with or affected by HIV. How to help protect yourself. To help protect yourself from HIV, follow these steps. Practice safe sex. Use condoms consistently and correctly during vaginal, anal, and oral sex. This reduces the risk of HIV transmission as well as other sexually transmitted infections, STIs. Get tested. Know your HIV status by getting tested regularly, especially if you engage in high-risk behaviors. Encourage your sexual partners to get tested as well. Testing allows for early detection and timely intervention. Consider pre-exposure prophylaxis, PrEP. If you are at high risk of HIV infection, talk to a healthcare provider about PrEP. It involves taking a daily medication that can significantly reduce the risk of contracting HIV. Use clean needles and syringes. If you inject drugs, always use sterile needles and syringes. Needle exchange programs provide access to clean equipment and can help reduce the risk of HIV transmission. Seek immediate care after potential exposure. If you believe you've been exposed to HIV, such as through unprotected sex or sharing needles, seek medical attention immediately. Post-exposure prophylaxis, PEP, may be prescribed, which involves taking medications within 72 hours to reduce the risk of infection. And don't forget to visit our website. Thanks for watching this video. Subscribe this channel. Share the video. Like, comment.